On this Sunday night, support for Nova Scotia. 1 week after the mass killing.
There are no words that can adequately express the sense of grief.
But can the survivors ever move on from this grief felt across Canada? The losses for potato farmers during COVID-19. The piles of produce with nowhere to go. A view from the front lines of the pandemic.
This is what I signed up for.
We go inside a hospital to meet the healthcare workers trying to protect Canadians. Plus, packing on the pandemic pounds.
We have turkeys and pizza and 2 bottles of wine.
Might be time to physically distance from the fridge.
Global National with Robin Gill.
Good evening. Thank you for joining us. We begin tonight in Nova Scotia, where the community is trying to heal 1 week after a tragedy that has shaken the nation. From coast to coast to coast, there's an outpouring of support and tributes to the 22 victims killed in a senseless attack. But as Ross Lord reports, there may never be a way to fully recover from the trauma of losing so many innocent lives.
Everyone wants to help ease the pain, but sometimes lining up gestures of support with people's ability to receive them can be difficult. It seems some friends and family members of the victims did not watch Friday's stirring virtual vigil in their devastated condition.
I've heard people saying I wasn't quite ready. I recorded it, and I do want to watch it, but I couldn't go there quite yet.
Grief counselors say people in the string of small communities hardest hit by the massacre are only now starting to grieve.
There are no words that can adequately express the sense of grief and loss.
This pastor says some parishioners are questioning their faith. He says many are turning toward the church.
We have others that are tuning in these days because people are more and more interested in what the gospel, the hope of the gospel has to offer them for their lives in these times of great need.
As investigators continue searching for a motive, there's a growing call for a public inquiry. It would examine what happened and how the gunman was able to slip past RCMP and use his Mountie disguise and mock RCMP cruiser to continue his killing spree.
Some element of independent oversight to ensure that the RCMP are being appropriately self-reflective about how they responded.
A public inquiry could also explore why the RCMP didn't initiate an emergency alert and instead relied on Twitter messages. A decision some friends and family say might have cost lives. Nick Beaton says his wife, nurse Kristen Beaton, would have stayed home had she been fully aware of the danger. The tributes continue. Runner Chris Harding ran 22 kilometers to honor the victims, shouting the names of each one to start each kilometer. Counselors say more creative methods may be required to help grieving communities adapt. Ross Lord, Global News, Halifax.
In Montreal, an 11-year-old girl is dead and her little sister is in hospital after being stabbed. Police were called to a home yesterday evening. Both girls were rushed to hospital in critical condition. Their 34-year-old mother was also taken to hospital with injuries. She's now been arrested and is facing charges. The 11-year-old died of her injuries last night. Her 5-year-old sister is now in stable condition. To the COVID-19 crisis now, the pandemic has affected every aspect of our lives, including the food sector. There isn't a food shortage. In some cases, there's too much of it. Producers in this country, from meat and seafood processors to potato farmers, are struggling. And as David Aiken reports, some of that food is just going to get wasted.
Canada loves its French fries, but Canadians prefer to eat their fries in restaurants. And with restaurants closed or only doing takeout, Canadians are just not eating fries like they used to pre-pandemic. And that's a big problem for Canada's potato farmers, who still have millions of pounds of potatoes from last year's crop that they have not yet sold.
That's huge. Like to our operation, it will be over half our gross income, which is, it will be close to $2 million that we would not realize.
Owen has 19 million pounds of potatoes stored on his farm, all of which would have been turned into French fries. But with the restaurant trade all but shut down, the freezers at French fry processors are full. They don't need any more potatoes. Meanwhile, what to do about this year's crop? Potatoes are typically planted right about now in early spring.
We're going to plant probably 15% less already. That's what their processors have told us to do. So, but there's no guarantee that if the economy doesn't turn around, that we'll be able to sell next year's crop, really.
And while Canada has too many potatoes, there could soon be shortages of beef, pork, and possibly seafood. A meat packing plant in High River, Alberta, that accounts for about 40% of Canada's beef has been shut after too many workers got sick with COVID-19. Other meat packers are also struggling to manage COVID-19 outbreaks. On Monday, a pork processing plant near Kitchener, Ontario, one that produces about 1/3 of the federally inspected pork in that province, is set to close for a week as plant owners deal with a COVID-19 outbreak there. Meanwhile, harvesters of fish and shellfish say they need urgent help to keep production levels up.
Harvesters are certainly interested in fishing, but they got to do it safely, and right now they're really unsure about if it can be profitable at all now.
Now, experts say Canada still has plenty of food, but they also caution that these supply chain problems could cause price spikes and shortages of some products. David Aiken, Global News, Ottawa.
Let's take a look at the COVID-19 numbers across the country right now. More than 46,000 Canadians have tested positive for the virus. More than 2,500 people have died. All publicly funded schools in Ontario will remain closed until at least the end of May. They were scheduled to open next week, but the province's education minister had to change policy based on advice from medical experts.
We're going to ensure that safety remains our paramount priority, which is why we're providing an additional month extension for us to work with Dr. Williams at the command table to make sure we get this right, to make sure that ultimately the students and staff, when they return, can do so with absolute confidence it is safe to do so.
The school closures in that province could be extended again. Meanwhile, tomorrow, Quebec's premier is expected to unveil that province's plan for allowing students to return to class. Health Canada has issued a warning about the use of certain anti-malarial drugs to treat COVID-19. The agency says chloroquine and hydroxychloroquine can have serious side effects and should only be used under the supervision of a physician. Health Canada issued this statement out of concern people are directly buying the drugs to treat or prevent COVID-19. U.S. President Donald Trump has touted hydroxychloroquine as a game changer. It is being studied, but early research found it was of no benefit in the COVID-19 fight. In the U.S., some states are starting to ease COVID-19 restrictions. Georgia, South Carolina, Oklahoma, and Alaska are all allowing some businesses to reopen. Colorado, Minnesota, Montana, Iowa, and Tennessee will begin easing restrictions this week. Stay-at-home orders for more than a dozen states are slated to expire by the end of the month. All of this is happening against the advice of health experts. As Jennifer Johnson explains, they believe the key to reopening the economy safely is testing.
With no social distancing and no masks, protesters across America are still sending out their message loud and clear. They fear personal bankruptcy more than COVID-19.
I decided to come out today because I want to rally for freedom over fear.
And we're shutting down the entire country for this. And it's just absurd. We're losing our freedom.
In Texas, Dallas salon owner Shelley Luther tore up a police citation she got after accepting customers. The governor doesn't plan to reopen non-essential businesses until April 30th.
I have rights. You have rights to feed your children and make income.
Federal health officials are trying to put the brakes on states reopening too soon and say social distancing measures should continue through the summer. They say new testing technology is needed to ensure everyone's safety.
We have to have a breakthrough innovation in testing. We have to be able to detect antigen rather than constantly trying to detect the actual live virus.
But Dr. Burke says those tests could be months away. Along with states, the Pentagon says it needs additional tests for those in national security, including military aboard soon-to-be deployed aircraft carriers. Defense leaders hope to increase testing from 7,000 a day to 60,000 by June. Meanwhile, governors are now battling a new problem, an uptick in calls to poison control centers after U.S. President Donald Trump made comments about injecting disinfectants into the body as a treatment for COVID-19.
When the person with the most powerful position on the planet is encouraging people to think about disinfectants, whether it was serious or not, people listen. And so we have seen an increase in numbers of people calling poison control.
Health officials are again warning people there is still no proven treatment or cure for COVID-19. Jennifer Johnson, Global News, Washington.
Outside the U.S., we're keeping an eye on regions where the number of new cases is increasing significantly. Russia has among the highest number of new cases, with more than 6,300 reported today, a single-day record. That brings the country's total to at least 80,000. Brazil also had its highest number of new cases yesterday, about 5,500. It has the most confirmed cases in Latin America, with more than 59,000 people infected. Another country to watch in that region is Ecuador. It has more than 22,000 confirmed cases, half of those reportedly on Friday alone. Testing and reporting in that country is spotty, and even the country's president warns the situation is far worse than it appears. Over 20,000 people have now died from COVID-19 in the United Kingdom, with 400 deaths reported in the last 24 hours. The total cases of COVID-19 in that country have now passed 152,000. Prime Minister Boris Johnson was one of those cases. He's now fully recovered and is returning to work tomorrow. Johnson was out of action for more than 3 weeks. He spent a week in hospital, 3 of those nights in intensive care. All patients in the Chinese city of Wuhan, where COVID-19 was first discovered, have now all left hospital after recovering. Health officials in Wuhan say that for the first time, there is no one suffering from COVID-19 in its hospitals. The city recorded more than 46,000 cases of COVID-19. More than 3,800 people reportedly died. Tonight, there is international intrigue over the fate of North Korea's leader. According to reports out of Japan, Kim Jong-un is in a vegetative state. U.S. intelligence claims the dictator could be dead or in critical condition after heart surgery that went wrong. China has since sent a team of doctors to North Korea. South Korea says Kim is alive and well in a rural area of the rogue state. New satellite photos show a train likely belonging to Kim has been parked at a resort town since April 21st. The dictator hasn't been seen for at least 2 weeks, and he missed the celebration of his grandfather's birthday.
This buzz for the blues.
Coming up, how advertisers now have to get the tone right or risk sounding opportunistic.
And we're going to show the world what great Canadian firepower is all about, and how resilient and how strong, how much love we have.
Tonight, it's Canada's turn to honor our frontline healthcare workers with a star-studded show. Stronger Together will be the biggest multi-platform broadcast in Canadian history. It will unite this country's biggest celebrities. Proceeds will support Canada's food banks. The show will be broadcast on 120 platforms, including right here on Global, starting at 6:30. If you've been spending a lot more time in front of the TV these days, you may have noticed a shift in advertising. With COVID-19 lockdowns, marketing campaigns had to be rewritten overnight. Here's Mike Drolet now on the struggle to get the message right.
By the time Canadians were being told to shut their doors and isolate, Tim Horton's marketing team was already turning their massive advertising ship around. Everything that had been planned was now out the window.
Our drive-thrus are here for you.
Replaced by sound advice from the drive-thru.
I can use an example of a natural disaster. When the hurricane hits, nobody does any advertising. But the hurricane passes in 2 or 3 days. The problem is this hurricane is taking 12 weeks to pass by. Can we just sit in a vacuum for 12 weeks? No.
This buzz for the blues.
The one consistent message across all brands is support for frontline workers and those who've lost so much because of COVID-19.
This buzz for the home team.
But what's really interesting is the number of companies that are putting out ads merely to keep their brands active. You wouldn't know this was an Uber ad until the end, when the company gives thanks for people not calling them. A similar sentiment we found from car manufacturers whose business has dried up, urging customers to stay home. But then you have all those ads companies have scrambled to pull. KFC has been using its finger-licking good slogan since the 1950s. But in 2020, licking your fingers is a big no-no. And who would have predicted so many people would be working from home? Coors Light and its official Beer of Working Remotely campaign would suggest Coors had an inkling, except those ads, which are no longer running, were produced months ago and were aimed at U.S. college basketball fans.
But separated, we are today more united than ever.
Tone is everything right now. No company wants to look insensitive, or even worse, opportunistic.
It's a super fine balance between, trying to use this for commercial gain versus trying to just stay in touch with Canadians and reassure that we're here for Canadians, I think is one thing, versus trying to, squeeze more commercial value out of people at a time like that. I think that's where you cross a line.
And don't expect that to change anytime soon, at least not as long as we're in isolation. Mike Drolet, Global News, Toronto.
Still ahead, we take you behind the scenes to show you how healthcare workers are fighting COVID-19. Across the country, many hospitals have been designated to specifically treat COVID-19 patients. For most of us, the true scope of what's happening behind the scenes is hard to gauge. Global's Sarah McDonald spent the day inside a BC hospital showing the grave risk healthcare workers face every single day.
Inside what is typically the province's busiest emergency department, the silence is striking.
It's a heightened anxiety, definitely, but it's changed our intake of people because we've told the people to stay away.
For those who simply can't, the first point of contact is a registered nurse, like Lisa Wright.
For the most part, this is what I signed up for. This is my job. This is what I do. It's fine.
You'll be asked if you have any symptoms.
We were invited inside by Fraser Health. Its leader no stranger to combating communicable diseases and past pandemics.
We've never had this level of measures that have been put in place. When you see some of the health systems that are supposedly comparable to our health systems and they're not coping very well, it does make you really take a serious attention to how we're preparing for this pandemic.
Health systems like Italy's, where the COVID-19 wave crashed with little warning and devastating consequences.
As sort of information came out of Italy, it radically changed our approach.
The approach to treating patients is changing just as rapidly as the data.
It starts in the lungs without a doubt, but the immune system, as it gets ramped up to fight the virus, can also damage the body. The muscle aches and pains that a lot of people complain of early in the disease are probably, at least in some way, the immune system, the inflammation affecting the muscles.
And deciding which patients need one of these can present its own challenges.
The reality is, when we talk about critical care, dying is not the worst possible thing that can happen to people. The ventilator is not harmless. So we have a big plastic tube that goes through the vocal cord so people can't talk, and they choke with every breath.
Fiona McLeod and her colleagues are all too familiar with one of the compounded cruelties of the novel coronavirus.
A lot of our patients are unfortunately on ventilators and can't speak to us.
But they can listen.
Recently we had a nurse who was in the room with the patient, holding the patient's hand, had the family on speaker, and assured the family that the patient could hear them, that they knew that they were there.
Are you worried about contracting COVID yourself?
Well, yeah, I think everybody is.
Sometimes the hand a patient holds isn't always familiar in a pandemic. Sarah McDonald, Global News, Surrey, BC.
Up next, the quarantine 19. How do you avoid too much self-indulgence in self-isolation? With stay-at-home orders in place, it's easy to find an excuse to wander into the kitchen where the recipe for packing on the pounds lurks in every cupboard. Tonight, Reggie Giacchini looks at ways to watch your waistline and help flatten your curves during the pandemic.
Sweet potatoes?
Yeah.
Isolation and quarantine have now become a new normal for most of the world. And while practicing social distancing is now helping to slow the spread, the more time we spend indoors leads to more time spent in front of open doors.
We likely will be snacking more often when we are working from home. That's just because we have easier access to our kitchen and pantry.
As more homes double as offices, practicing social distancing from the fridge has become food for thought. And dietitians say remembering your old routines can help put off the dreaded quarantine 19.
Follow a schedule as if you're going to the actual office, meaning that you would dress up for work, scheduling breaks in between your workday.
Big changes in life can often weigh on us. The freshman 15 is a lesson most college students learn when they're left to their own devices. And while adults may not be binging on boxed mac and cheese and 99-cent ramen, we are pushing it to the extreme.
We had cookies and pizza and 2 bottles of wine. We've had Cheez-Its, fried chicken, and we're feeling fine.
But while it's tempting to dip into the treat cupboard or bake up a storm, it could lead to some regret down the road.
It becomes more stressful when it starts affecting our sleep or when we're waking up and we're not feeling good about ourselves or our appearance or our energy levels.
Experts say getting up and out in a safe manner, even for 20 minutes a day, can stop you from having to pop a new hole in your belt.
People need to look at this as a time to take advantage of and get themselves into a better place so when this time expires, we're able to kind of jump back into the workforce and, the environment that we're used to being in.
Emotions often run high in times of stress, and that can lead to unwanted binging. And with no certainty over when this will end, there may not be a rush to get that summer body. But that doesn't mean we shouldn't practice safe snacks.
When does it become too much? When it starts affecting you mentally or physically.
A delicate balance of feeding our need to feel normal without overindulging. Reggie Cicchini, Global News, Washington.
And that is Global National for this Sunday. I'm Robin Gill. Tonight we leave you with a young man's sense of humor to keep your spirits up.
What is a bug that's hard to understand?
What?
A mumblebee.
That's 6-year-old Callahan McLaughlin. Every morning he sets up a joke stand outside his home in Saanich, BC to provide his neighbors with a quick quip. Thank you for watching. Good night.